Hi, everyone. It's Valerie with the US Canada portion of Meant to Be Well. It is day 2, and I am super excited to have my 13th speaker for day 2 here with me today, my good friend, Hannah Balow. And I want to tell you more about Hannah. I just love everything she is doing. She's going to talk with us about mental health in pregnancy and postpartum. And she's joining us from Chicago, Illinois, United States, also where I'm located at. And Hannah is a family nurse practitioner with a certification in perinatal mental health. She is a passionate advocate for maternal mental health and uses her own lived experience with postpartum OCD to shift the stigma around mental illness and bring hope, education, and support to moms and families. So thank you so much for being with us today, Hannah. It's an absolute
Absolutely.
pleasure.
Yeah.
Oh, thank you. I love everything you're doing. First of all, let's talk about mental health and pregnancy in the postpartum period. And I would love to hear more from you about it because I know you are super active in that community and it's so important.
Yes. And I'm so thankful for the other mom at our gym who connected us because she knew our passions. And
Yes.
we are in the same town. So Val is amazing too. And I'm wearing my Two Mamas to Love shirt, which is Val's motto. And Val's amazing too. So yes, I'm always so happy to talk to you, Val. So
Thank you.
yes, I am super passionate about mental health in pregnancy and the postpartum period. And I just believe that knowledge is power in this area. And so if I can provide any knowledge to um, parents, to providers, that is my goal. So yes, and I also am really passionate because I have my own lived experience with postpartum obsessive compulsive disorder, which is also one of the more misunderstood of the perinatal mood and anxiety disorders. So even being a medical professional, I didn't really know what it was and didn't really know where to go to get support and help. And it was a struggle for me. So I'm just very passionate about making sure that everyone has resources and an understanding about this. So we often hear about postpartum depression, but there is a lot in terms of perinatal mental health that we don't hear about that is so important. So there are other mood and anxiety disorders that can come about in that can start in pregnancy or postpartum or become much more significant. And also that it's not just moms who might experience perinatal mental health challenges, it's dads as well. And we don't even have a lot of good statistics on that, but and everything I have in terms of statistics is from Postpartum Support International's website. So for moms, this perinatal mood and anxiety disorders, which can include depression, anxiety, OCD, PTSD, postpartum psychosis, panic disorder. For moms, it is 1 in 5 moms who experience one of these. And really, I mean, that is 1 in 5 out of the people that we're screening and the patients who are able to say what is going on. There's a lot of fear, and I'll talk about that in a moment too. So at least 1 in 5 moms are experiencing this, which makes this the most common complication of childbirth. And we talk about so many other things in pregnancy.
Yeah.
Screening for diabetes, so much that is the focus. And I just feel like a lot of times this is not the focus, but it really needs to be. And I just am passionate about making sure people know what is possible to happen, and then that they have resources if they are seeing any of these signs come up for themselves or for a loved one or for a patient or a client. So 1 in 5 moms will experience perinatal mood or anxiety disorders. And then 1 in 10 dads will develop postpartum depression. And that is also out of dads that are being screened, which is probably not many. And then dads who are also able to, articulate what is happening. It might, um, symptoms of depression in dads might look different than for moms. And 5 to 15% of dads will develop an anxiety disorder in this time period of like pregnancy or postpartum for their partner. So, this is obviously just a huge issue, and there is so much support that's available, but sometimes it can be hard to find that, and a lot of providers might not know where to send their patients or their clients. And then also something interesting to note is that, so when we think of perinatal mood and anxiety disorders, I said depression, anxiety, obsessive compulsive disorder, PTSD, panic disorder, and then I also bipolar. Bipolar, 50% of women who are diagnosed with bipolar are diagnosed in the perinatal time period. So in pregnancy or postpartum. I did not know that until I started volunteering with Postpartum Support International. And as a medical provider myself, as a nurse practitioner, I realized that is really important to know that. And I had never heard that. So this is obviously a time to really be having these conversations with women who are our patients or our clients, or even our friends or loved ones. Have these conversations of how are you really doing? And then if they are noticing some symptoms or some changes, being able to connect them with support as soon as possible. And one of the things also is just what we are passionate, Val, and you are so passionate about this, is breaking this stigma of, and what I've heard other presenters share, we are not in control of if we have a mental health diagnosis, but we are in control of our response to that, our willingness to receive help. And maybe at a point that's not even us reaching out for help. Maybe that's a family member or a friend or a doctor or someone saying, this is what we have for you. And being able to receive that support and help is extremely strong and extremely brave. So I am very passionate about breaking this stigma of, and I think that's why one of the reasons why it is so hard to talk about this as a mom or as a dad in this time period where you are expecting a baby or have had a baby, is that you feel that you should be happy. And it is also okay, and you can be happy that you have a baby or are having a baby and also be struggling a lot. It doesn't mean that you are one or the other. It doesn't mean if I am having symptoms of depression or anxiety, OCD, bipolar, PTSD, whatever it may be, psychosis, that I am not a good parent or that I am not fit to be a parent. That is not true at all. It just means that this is a time where we really need to get you set up with support to get through this. And thankfully, all of the perinatal mental mood and anxiety disorders are very, very treatable. So that is good. So there is so much hope. So yeah, and I think it's just important to know, like, as I said, we can be struggling and also be strong as parents. We can be hurting and we can also be healing at the same time. And we can be suffering and loving our children deeply. It is not one or the other. We can do both. And doing both at the same time is strong and it is brave. And that is how we can choose to navigate something that we didn't want. We can choose to lean into our support system, and like I said, to receive help or to ask for help. And we can also be free to receive whatever kind of mental or medical health help that we need, even if that means being away from our children for a time. There's a lot of a lot of feelings when that happens with a mom too. And that doesn't mean in any way that she is not a loving mom or fit to be a mom or a wonderful mom. That is a strong thing to say. I need help and I need, help now. And I'm going to take this time to get that help so that I can be the best mom I can be. So there is so much support. I think it's just so important as providers, clinicians, therapists, loved ones, family members, grandparents, to be aware of what, and I don't have time to get into depth about what each depression, OCD, PTSD, what it might look like, but just to be aware that there is a lot more than depression. Postpartum depression is significant, and perinatal depression is significant. It's more common than we think about, but there are also other things to be looking for, and that there is help that's available. As I said, Postpartum Support International is such a great resource for anyone needing to be connected with resources or receiving help in the perinatal period, which is pregnancy or postpartum up to a couple years postpartum. That doesn't mean just like 3 months postpartum and then we can't help you anymore, because a lot of these also are not diagnosed until quite a ways after delivering. There's just so much that happens in adjusting to being a parent. So Postpartum Support International has support for moms. They have a helpline that moms can contact for free. They can just text. You don't even need to call and talk to anyone. There is a hotline that is answered in live time. That can be text or phone call. It can also be, that can be a grandparent. Like that could be a mother calling. She's worried about her daughter who has just had a baby and she's worrying about her. That could be a spouse, or that could be a friend. That could be a therapist calling or texting, reaching out to the helpline saying, I really want to connect this person to more like just support groups or something like that. And Postpartum Support International is able to help with that. And also another thing, since there's a lot of mental health providers here in this group, there is a free consultation line for prescribers to get a free consultation with a perinatal psychiatric specialist, because a lot of times we as providers maybe don't feel as comfortable in that pregnancy or postpartum or breastfeeding. What medication should we give? But as we know, also the psychiatrists are not as many as we need. So a lot of times these might be the OBs giving these medications, and they feel that they really need some extra support in figuring out what is the best medication and what's the safest. So that is a resource for prescribers as well.
That is incredible. I had no idea that there was that resource. That's amazing.
Yes, it's great. Mm-hmm.
I have scrolling down on here, postpartum.net. Is that how you can access all of this information?
Yes. Yep. Mm-hmm. All of it. Yep. The helpline, the hotline. There are support groups. There is, just a wealth of information, and the psychiatric consult line too. Yeah.
That's amazing. That is all in one source.
Yeah.
We have a question here. What are the triggers of postpartum depression and how can we avoid them?
So that's a great question. I think I wish I had a lot of time to get into it so in depth. But I think there can be, if you have like a patient or a client who has had depression or anxiety in the past, you would want to be thinking they would be at a higher likelihood of experiencing one of the mood or anxiety disorders in the perinatal time period. And then also just, I think it's really complex. I think there's so much that goes into it. It can be, it could be a lot of different things. It could be how their support system looks, how their delivery happened maybe not as they expected, or maybe a traumatic delivery, or obviously there are so many different factors, but I would say in terms of if you are a provider, um, thinking about like having that on your radar,
Mhm.
obviously everyone is going to be screened at like their 8-week
Mhm.
appointment, but I would be um, really watching closely to the moms who have experienced depression or anxiety or really any mental health challenges in the past.
Mhm.
And then also, if you know that there is something going on, whether that be something going on in family life at home, in the relationship that they have with their partner, in a lack of family support, financial struggles, financial burdens. I hear that a lot from moms who are off on maternity leave, who aren't making income on their maternity leave, which that's another topic too.
Mhm.
And so there are just so many different factors. Um, but yeah, and also so lack of sleep is a big trigger for any of these.
Mhm.
So really, if you're as much as these moms are able to protect their sleep, we talk to moms about that a lot too, in getting as much support as you need in protecting your sleep, whether that be your partner, if your partner is able to be helpful in sharing the responsibilities for sleep, or if you have a family member, if grandma can come over, or if you have a sister who can come over, a brother, anyone who can come over and help and let you get some sleep, or a postpartum doula. I know that is not something that is accessible for everyone, but if it is, that can be a really helpful resource too. So yeah, so there is so much that is, and sometimes what I found too is sometimes de- postpartum depression doesn't always look like what we might think it looks like. It doesn't always look like sadness, crying. Sometimes it can look like just like extreme fatigue.
Yeah.
Um, and sometimes it can look like just a lot of irritability, maybe rage. Rage is another thing we don't talk a lot about in terms of perinatal experiences, but it is a common one too. So, yeah, so great question. But I think it's so complex. But anyone who has had a past mental health diagnosis, I would definitely be really screening them, or then if there's anything pretty significant going on. But also, it can be with someone who doesn't have anything, it could be anyone. So that's why it is so important to screen everyone.
Mhm.
Um,
Yes.
and my preference would be to screen everyone a lot more often than the 8-week visit, or like, when you're in the hospital still and you have to do the postpartum depression screen and then your 8-week OB visit. I think a lot more, Val, we've talked about this too. I think a lot more pediatricians are realizing that they are actually the ones seeing moms.
Yes.
So that is really like, it shouldn't be. I think one of the issues is that we don't really know who's doing this screening. Like the
Yes.
OB, how often do you see your OB after having a baby? Like
Mhm.
once, if this has been a healthy delivery. And that one time is not enough. So
Yeah.
I think some, at least around me, the practice that I take my kids to, their pediatric practice said that they are doing more screening for moms. I don't know that they're doing it regularly, but definitely if they have any inclination that something might be going on, or if babies are more colicky, you're having a lot more difficulty with sleep or with feeding issues, they'll do the screening and then refer moms to support. So,
Mhm. Yeah, absolutely. And I think that's such a great point of like, how many times did I see my pediatrician? Like
mhm,
this
yes.
at
Yeah.
the beginning. And so I think having those conversations are so important for
Mhm,
providers that are going to be seeing moms,
Yeah.
or or people that are interacting with moms, like maybe
Mhm.
dads bringing them in, whatever it is. I think it is so important. We need to have these resources, and am so I'm so glad to know that Postpartum Internet Support International
Mhm.
has, like, it's
Yeah.
almost like, I don't know what word I would say, but it's like it has all the resources in one, which makes
Mhm.
it easy, which is
Mhm.
nice. It also, it talks about 988, which is, I know
Mhm.
that's also a resource as well. But this is specific for the postpartum population, which is so
Mhm.
important. And we have postpartum depression, which you also said there's like all sorts of other
Mhm.
perinatal postpartum disorders. And I
Mhm.
don't know if I should say the word disorders, but there's so many
Yeah.
things that
Mhm.
can be brought up in that
Yeah.
time. Sometimes
Yeah.
there's more than one, and some
Right.
of the symptoms are the same. Sometimes
Yes. Oh, absolutely. Yes.
so
Yes. You could
complex.
have
Mhm.
depression and OCD or PTSD and OCD. It doesn't mean, it's just one. So it can be complex. And so that's also why just having providers who understand this perinatal period
Yes.
are really important. And Postpartum Support International also has a list of providers you can put in your city, and then you'll find a list of therapists or prescribers who have been trained by PSI. So that's a really helpful resource too.
That's great. And I put in the chat links to you. You were actually my first guest on my podcast. I
Oh,
like
I know that was so fun.
It was so fun. And so I put that on there
Mhm.
because you talk and share a lot about your OCD journey,
Mhm.
which I also experienced as well, some
Mhm.
OCD before pregnancy and afterwards. And we've talked about that because that is kind of an under, we don't, I think people don't know about its symptoms
Mhm.
as much because it can kind of masquerade as others sometimes. And so I know that we're running short on time today,
Mhm.
but I think that is a very important topic.
Yeah.
So definitely check out that episode where you share your
Mhm.
story. But is there anything in particular you would like to share about that in particular? Because I know you are such an advocate for OCD awareness.
Yeah, absolutely. Just a couple of resources. So again, yeah, my passion there is that OCD is so misunderstood, that is even a lot of providers will think OCD would have to look like someone who is afraid of germs and is washing their hands a lot, which absolutely that could be
Mhm.
how OCD presents. But there are so many other ways too. And in the perinatal period specifically, those are a lot of times thoughts, the fears. So the obsessional thought is something that is going to be very, very difficult for moms or parents to say what it is, because it is often about possibly doing something terrible, possibly harming your child, maybe unintentionally, maybe intentionally, um, being irresponsible, losing control. Those are a lot of the ways OCD shows up in pregnancy or the postpartum period. Again, Postpartum Support International is where I found a lot of support on my own journey to healing through a support group for OCD, and then the International OCD Foundation is also a really great website. They have conferences, they have like a lot of great like town hall meetings online, a lot of free resources also for the OCD community. And so yeah, so that PSI and then the International OCD Foundation are great ways to get connected to the OCD community. Um, so yeah, yeah, so
That's great. That's great information. I put the link in the show notes as
yeah.
well, because I think that's so important. I remember, like, with my OCD, it was so much of this worst case scenario thinking,
Mm.
and no question or no
Mhm. Yeah,
would suffice. And
right,
I knew it was this
right.
challenge, this battle in my brain. And it was so frustrating though that, like, I felt like no one understood that, like, it was just kind of like I was loved as this like, it was put in this category of anxious mom. And
Mm.
it was frustrating because it's like, I obviously I'm anxious, but like there's more
Right.
to it. And I didn't know of these resources. Obviously, the providers
Mm.
didn't really know either. And so I think the more awareness we can spread about that, and the way that
Mhm.
it is so complex, but there is this one stop shop almost where you can
Mhm.
get more education on the variety of perinatal mood disorders,
Yeah.
both
Mhm.
for
Yeah.
providers and clinicians. It's wonderful.
Yes.
Yes, that's great. Well, Hannah, thank you so much again for
Absolutely.
sharing your expertise. I absolutely loved talking with you. Is there anything you'd like to leave with us before we go?
I think we're good. And I appreciate everything you are doing too, and that you are a fellow mom, mental health advocate, and friend. So, yeah,
Absolutely.
it's a
Thank you.
pleasure.
I appreciate you, friend. And thank you so much, everyone who is commenting in the chat. Really appreciate all the community, and definitely check out all the resources here. And I hope you have a wonderful evening, Hannah.
You too. Bye,
Thank
Val.
you. Bye.